Hi, welcome everyone. Thank you for joining. My name is Kristin Snowden, and I'm a licensed marriage and family therapist in the state of California. But this is not therapy. This is just part of a regular monthly webinar with sexandrelationshiphealing.com. And I like to cover several topics on what I find to be regular couples issues, regular marital issues, regular issues that happen within relationships. So it can even be non-romantic relationships, it can be friendships, siblings, family members. And just in my private practice, when I'm working in my treatment centers, these are the topics, I talk about the topics that just kind of regularly surface. And today, in the spirit of Valentine's Day, which is coming up this week, we're going to talk about very common topics that are always surfacing in a couples therapy session. So to kind of set up the scene is, all right, something's happened in the relationship that's made us decide that we need to go to couples therapy. For a lot of people who tune into my YouTube channel or who go to sexandrelationshiphealing.com, they've maybe uncovered an unknown addiction, substance abuse addiction, sex or love addiction, and they're trying to kind of pull the pieces together after a shattered relationship, lots of betrayal. Sometimes there's infidelity, lots of money spent, lots of lies and manipulation that's present in the relationship, and they're going to therapy in a very broken state. So one of the most common questions that come up are, when am I going to feel normal again and be able to trust not just my partner, but trust myself again? So those of you who've tuned into the most recent videos, I've talked a lot about betrayal trauma and what it does to our physiology, what it does to our ability to connect with other people and form relationships with other people. So I'm not going to dive too deeply into that. But I'm just going to say, and I think you've heard this if you've listened to any other therapist or psychologist who talks on sexandrelationshiphealing.com, but every dynamic of your relationship as you knew it before, kind of before the nuclear bomb went off, is probably going to be decimated, because you are going to see that person very, very differently now. We come into relationships as very flawed human beings and come with our own baggage. And since we don't really take classes or there's no schooling on this growing up, we're not really aware of all this unconscious baggage of, the shame that we walk around in, because wherever we have a strong wiring to want to connect with people, we have a deep fear of, what if we're not enough? What if they see me? What if they know this about me and they find out that it's not what they want anymore? So we work a lot in our lives to try to cover that up through lying, through manipulation, through kind of performing, in order to feel like, okay, I got this. I'm going to be loved. I'm going to keep this person in my life. So obviously when a really brutal truth is uncovered, like this person's been living a whole double life and I never even knew it, there's gonna be having to be a new construction, a reconstruction of, okay, well, who am I and who is this person? Do I still want to be with this person? What's going on here? And then there's also the physiological consequences of it. So at this time, this partner, this person in your life was someone who you were bonded with, someone who was what we call like a co-regulator. So you look at our autonomic, like our entire nervous system, and so much of our nervous system is about reading other humans and allowing them to kind of send nonverbal messages to us to let us know, how threatening are you? How safe are you? And then I unconsciously respond according to that. So a lot of these messages are received through like facial expressions, gestures, showing that one's listening, showing that there's like reciprocity in the presence of the relationship. And so all of those things get thrown off, because you suddenly, despite the fact that you thought that your partner was present, was safe, was tracking your goals, was putting you as a priority, suddenly you're finding, okay, no, that's not the case. And your brain likes to generalize things. So it doesn't like to go, well, maybe just in this one situation, right? So maybe just when this person was having the affair, or maybe just, in the addiction. they were lying to you. But in all other facets of their life, they were being present and honest. Your brain doesn't like doing that because there's not enough time. It would, if like, if a car was coming at you and you had to jump out of the way, it has to operate very quickly with very little blood flow, very little oxygen to get you out of the way. If it stopped and said, should I jump over the car? Should I run to the left? Should I run to the right? Why am I even standing here in the middle of the road with this car coming at me? What even led me to be here? No, if it stood there and didn't make an really quick generalized assumption about how to get you to safety as fast as it can, then you would be dead. None of us would be walking around right now. So sadly, that's the same thing that happens with humans when they've demonstrated to us that they're unsafe, is we make this really overgeneralized statement that if this one facet of you is dangerous and a liar and capable of manipulating and not keeping my safety and best interest in mind, then the whole thing must be bad. And so there's got to be a lot of work towards healing that. And something that's most important to realize is just removing the threat does not heal that. So just removing the, hey, I'm not doing the addiction anymore. Hey, I swear I'm telling you the truth now. Hey, whatever that issue was, we've dealt with it and we're moving on. That does not help someone's neurobiology calm down and feel safe again. It actually needs to keep seeing that your facial expressions, your gestures, you're listening, you're plugged in, you say what you mean what you say, and then slowly someone can kind of reconnect with you and get to what we call like a ventral vagal state with you, where I'm in a calmer, more co-regulated state where I can be present with you. And that's the state where like intimacy and connection can occur. So also as a side note, when trying to get to a place of trusting and kind of harmony and connection again, the act of human touch can also be very helpful. However, in the beginning stages, when you're really hurt and betrayed and upset, it may be too scary to do any kind of physical touching. So that might be down the road. But in the meantime, you can always seek out, hugs and comfort and cuddling from pets, from other family members, from friends. But that touching can be neurobiologically, it can be very, very healing. It can lower your stress hormones, get back to a co-regulated state. It can bring in more helpful healing like oxytocin and serotonin. Those are positive healing type of hormones. So really just kind of listen to your body. And I'm going to be talking, I think next webinar, I'm going to be doing something on the polyvagal theory, which is just kind of full understanding of how we can kind of wire and help fix and become aware of our neurobiology to really get out of this. Stop feeling like our body has control over us and like we have control over our body when we're trying to get to a state of feeling safe again. So, because again, if your neurobiology is off, if you're walking into an environment where you feel so unsafe by your loved one and you feel so hurt and betrayed, and are they saying the truth? Are they saying what they meaning? Are they really in recovery? It obviously doesn't just affect your relationship. You're going to struggle. The same neurobiology that deals with this level of safety. Is this person safe? What kind of threat are they? How do I get myself to a safe state? Is the same part that's connected to our our health. So people all the time will, struggle with being able to sleep, relax, sleep. They have major digestion problems. They have struggled performing basic bodily functions. We need to feel safe in the relationship and around everywhere in order to actually physiologically function and function not just in this relationship with this partner that we're struggling with, but with every single other person. So I hope I've gotten that point across to you. You need social cues to feel safe again.
I had somebody that was talking specifically about this again, and they were talking about it was so pervasive, this broken relationship, and it was their health. It was everything. It was finances and everything else. And she, it was a female. She was feeling like there was no way out. It had so colored all of her relationships in her world, you know. And so when you're talking about this, you know, and like, you know, the non-safety, and while sometimes it's like just with this person isn't safe, but I think when you're talking about, like, it really, you know, it can make you question it. Is there anyone or any relationship that is safe, you know, and going to really be able to support me? And so even trying to find, you know, safe people that can give you healthy touch, and, you know, like you said, friends and whatever. How do you even kind of reset? How do you even explore who could possibly be safe, and how, when it's that dysregulated?
Right. You know, and I work with betrayed partners often. And I have a couple right now who are extremely dysregulated, right? So one minute, maybe their marriage is moving along okay, they're seeing the progress, and the next minute they just can't stop crying. They're walking into an attorney's office to talk about divorce, because again, there's just this roller coaster of, is this person safe? Is it not? And the thing that I always equated to is, just imagine if there was an extremely threatening thing in front of you at all times, like a bear who could just rip you to pieces, or a physically dangerous person who could just beat you to heck, you know, like, that is what your neurobiology is telling you every time you're engaging with this person. Because again, your autonomic nervous system is just meant to pick little tiny pieces, make a really quick assessment of, is this person dangerous? And it's fascinating just how quickly it works, and from what it could just be a simple face expression, a simple tone of their voice, a gesture, just something. Like, so many of my clients are just like, there's something that he or she said, it didn't make sense. And I suddenly lost myself, finding myself looking at text messages and phone records, you know, and because I'm just, what they're doing in those moments is just seeking safety. It's like, please God, just show me something that can tell my neurobiology that I'm safe, right? So the thing that I always coach clients in that state is that, look, this partner, you ain't going to get safety messages from this person yet. Hopefully, if they stay on track and keep kind of saying what they mean what they say, really work on repairing with you, and maintaining a recovering life, and kind of really get a narrative in their head about why they did what they did, what the triggers were, what they're planning on doing to replace those triggers, to replace that coping skill, right? So you're seeing this whole story that's not just, this person's extremely dangerous. You're seeing that this person now has complete, full understanding of what's going on here. And then you can kind of lower your fear and threat level down, because they have this whole other plan. But in the meantime, you need to get that co-regulation and messages of safety from a new set of people. You cannot isolate when you are in a state of recovery, or I'm sorry, in a state of crisis. And this is the biggest problem, is you're in so much shame and fear and paralysis, just total paralysis of, oh my God, my kids, now am I going to afford this? And where am I going to move? And oh my gosh, attorneys are so expensive, and treatment's so expensive. And I can't afford to go to a therapist anymore, that you can't even perform basic bodily functions, basic decision making. But you have got to push through the isolation and the paralysis, because you have to go to a new system to help regulate you. So whether that be a group of trusted loved ones, support groups, therapists, family, friends, that you have to get this state of groundedness that, you know, all people are not dangerous, that I am capable of actually calming these moments down, right? Because it feels so out of control. We need examples that we can have these little glimmers, these little moments where we're not in this state of fight, flight, or freeze. And it's, you can suddenly find yourself at coffee with a friend and being like, oh my God, I haven't cried in an hour. Like, I've actually been able to pay attention to her conversation, and I've been able to be present for a second, or a moment with your children, or a moment at work where you're like, oh, for like a millisecond, I felt like a normal human being. You need to seek out those little moments, those little glimmers of hope that you can get to a properly regulated state. Obviously, if humans are too scary, if you have a lot of trauma where humans have hurt you, I'm always saying too, there's so much evidence now that animals, pets, can be a really great substitute for that. You know, equine therapy. That's why there's a lot of those emotional support animals around. That there's this idea that this animal can co-regulate me, can bring in, lower my blood pressure, lower my stress hormones, and kind of be present with me. So people will say, when can I trust again? When can I trust my partner? And I think like the question that's coming up might talk a little bit about this, but the fact that once you see what a partner is capable of, once you see that they can just lie to your face, completely kind of leave this planet Earth and go off to this crazy reality, that has nothing to do with any consideration of you, your safety, your family, keeping you guys as a priority. I don't think you ever lose that. That just kind of gets emblazoned in your long-term memory and just be like, this is what my partner is capable of. So I think that no matter what, these co-regulation skills, understanding your neurobiology and having other sources to kind of calm your nerves down, get grounded, are going to be imperative. Because you know, when they say, when can I trust again? I struggle with the definition of trust, because I kind of come from a place where I believe one of the number one rules that you have to embrace is that we're all perfectly imperfect. You know, we all execute things in the best way we try, but very imperfectly. And so to kind of trust people blindly is just setting ourselves up for insanity and struggle. But there's just kind of this level of, I've really honed my instincts. I've really honed my understanding of my neurobiology. I always listen when like the bells go off in my nervous system, and I go, okay, what's going on? Like, what face expression did I see? What kind of signal did I just notice that's got me in the state of anxiety, in the state of like, I don't feel safe, I don't feel comfortable in my skin. And I really work to kind of scan through all that. And that's without my partner. And then if it has to do with my partner and something comes up and works through my vetting system, I'll say, hey, when you said this is what was going on for me. Or when you behave this way, like this didn't feel good or right. Like, am I misreading you, or what's going on? So that's going to be a cue that's required like forever.
Questions, and one of them keys into kind of what you're talking about. I'm starting to
Right.
feel normal, but I'm afraid of crashing again. How do I enjoy this feeling without letting my guard down too much?
I think this kind of goes back. You do need to listen to your body, right? So if you do start crashing again, then again, that's your autonomic nervous system telling you. So let's say that's putting you in that dorsal state of, you know, the turtle pulling its head into the shell and needing to kind of be in a paralyzed state. And you really have to reference, is that because there's a current threat? Is something, did I see or experience something that's leading me to feel extremely threatened and unsafe in this moment? Is there a legitimate threat? Or is it something that kind of sent me into a flashback state that made me feel helpless? You know, like this is never going to get better. This is, because sometimes it gets really, really murky with what is an actual state, an actual threat of safety in this moment that you need to deal with. Like maybe because your partner is not in recovery, or they're kind of up to incongruent acts that's making you really question, or maybe one of their biggest triggers is that they overwork and suddenly they're back to their 60-hour work week, right? Then that's saying, okay, well, what this is I know this is one of the biggest relapse triggers that my partner does, and he's slowly going down that slippery slope. So all I know is I just have this constant state of feeling unsafe because I'm waiting for the next shoe to drop. And that means that's a trigger for you. You know, it's really great feedback for you that you need to take in and bring into the next couple session, or with your partner directly, to say, look, I cannot feel safe when I know one of your biggest triggers is that when you overwork, you kind of suck your soul dry, and then you feel entitled to go act out and do these behaviors because you're trying to just meet a need that you don't really know that you need, but you're starved for. And I'm not okay with that. Like, you need to continue to show me that you know how to do self-care, to kind of manage yourself and keep yourself healthy and stable, because when you're healthy and stable, my neurobiology can calm down and I can be present. And let me just say that too, when things feel normal again and calm, that can create hope. And so when things are calm, that probably means things are going better and things are going well. And just know, for your neurobiology, once things go well and once things appear better, that gives you something to lose, right? So your vulnerability, the exposure, the feeling of being exposed to that hope, to, oh, this has been so nice. Oh God, I don't want to lose this. Oh God, please don't let it get bad again. Just know that even though it feels still, it feels normal, your neurobiology isn't always going to be like, oh, that means I can kick up my heels and chill out. No, now it's like it knows what it needs to protect, and
Yeah.
it's like on guard, extra hyper vigilant, hyper aroused, trying to look out for what else is going to come take what's precious to them.
That
So
makes sense. I hadn't thought of it that way, but I hear often people going, I'm waiting for the other shoe to drop,
right.
and so, that gives them the neurobiology of what's happening. And fortunately for me, I've been able to go, sure, another shoe is going to drop at some point. I don't know how big it will be, but in the
But I
moment,
can handle it.
yeah, well, but I've got support. It isn't just me handling it. It's like I've
Right.
got support, I got a program, I got resources that I've developed and honed over time. So,
Right.
and I'm like, if I can do it, you can do it. And it's just finding those safe spots to do that. There's another question over here in the chat. My husband is seeing a non-CSAT therapist twice a month, and he has done his circle zones, but nothing else. No groups, etc. First D-Day was January of 15. Wow. Okay. 3 more since then. Last one was 9 months ago. Porn addiction was his coping choice. He firmly believes and tells me that my behaviors, acting insecure or jealous of other women throughout our relationship while he sexualized, rejected me for years and objectified everyone, is his argument and belief that I am not safe for him, and I am why he struggles. He has told me recently that it's my character and personality that caused him to be drawn to me sexually. Or what do I even do with that? I'm considered a very kind and nice person, and I have always loved who I am. He's the first person in my life to tell me there's something wrong with the person I am. I'm really struggling with this, and I can't do anything to make him see me for who I really am. How do I protect myself from this? It's been making me feel really unsafe. We haven't had a healthy, intimate life in over 8 years.
First, I'm really sorry. That stuff is deeply, deeply, deeply painful to have the person that you were planning on spending your life with and loved say those really, really painful things to you, that, I'm just not attracted to you as a person, that there's something wrong with you. Um, I have lots of things that come up when I hear that. First thing is that when clients are still acting out, so they're not in recovery, um, one of the common signs that they are not in recovery and in like a state of kind of understanding their stuff and their crap and why they do what they do, why they make the choices that they make, is they externalize the problem. So if I just liked having sex, if you were just better in bed with me, then maybe if you didn't nag me so much, or maybe I just like really exciting, new people, and just one person in monogamy is not for me. I think maybe I actually settled when I married you. I think I thought you were this and then you weren't. So kind of what I always say is if it's really hard to gauge because they're saying these horrible, difficult, painful things to you. But one of the things to really look is does that also come with a full narrative where they seem to fully, completely understand why they do what they do, how they struggle, how they've harmed people before, how they've used people before, how they've maybe screwed up in the marriage themselves, how they've screwed up outside the marriage. And then additionally, there's these understandings that there's these difficulties in the sexual dynamic going on, or difficulties in the relationship. That's something that we can all work on, right? Is when people bring the whole picture, the whole dynamic into the therapy room. Not just she's the problem, I married wrong, if I just had more exciting sex, and not about what I'm bringing into the picture, but the harm I've done. And by the way, let's not even forget that it's, again, remembering neurobiology, it's really hard to be like a sex vixen when your husband's viewing porn chronically and has regularly kind of knocked you to the ground with all these intense levels of betrayal. Like, it's so hard to want to make yourself vulnerable to someone who's harmed you so much. So I guess what I'm trying to say is all of that stuff is fixable. But I don't know, maybe I'm just a forever optimist, but it's from what I do for a living, is anything in a relationship dynamic is fixable if there's willingness. But there has to be an appreciation and accountability for the entire picture, in my opinion. It's not just like, hey, these things really bug me about you. There has to be an understanding. But go ahead, Tami, we want to add to
Well,
that.
no, she added, no, there is no narrative, just him saying he takes responsibility for making poor choices with porn and disrespecting me. But to me, he's not in any kind of recovery. I mean, you've
Right.
had repeated, D-days, and and he's not doing anything. So it's like he's seeing somebody sort of and doing a little bit, but he's not doing what he would need to do to really change. And so you're stuck with this person who's kind of given lip service to, well, I've got my 3 circles, but I'm just going to keep looking at porn because your behavior's causing me. Dr. Rob talks all the time about there's nothing that you can do or not do, that can cause him to do that. He's got choices, and he's choosing to just go, well, I'm just going to, justify, like, Kristin was saying, it's like, I'm going to externalize my reasoning for, what I'm doing. And sure, I'm going to say, oh, sorry, sorry that, I made poor choices and, I'm disrespecting you, but I'm not going to really change, so you're really caught in, as Kristin was saying earlier too, you've got the bear in the kitchen, on the way to the fridge, and you're right next to the fridge, going, this is not safe. And so it's this constant dance of, this isn't safe.
And why don't we have this magical intimacy? Why isn't there this intensity? Why isn't there this sexual experience? And it's like someone can destroy your personality and just start picking you apart. Oh, why aren't you more spontaneous in the bed? Why don't you tell me all your deep thoughts? Why don't I feel this draw towards you? And it's just like, I really hope that you have the presence of mind to say, because you scare the crap out of me. Like, so many times you have knocked me down to my knees, and I have just found that you are capable of doing so much lying and manipulating that how would I want to have sex with you? How would I want to be spontaneous? I'm just trying to like get out of bed and function being with you in the house.
Yeah. Well, and the thing about porn is it hijacks the brain, and it's all these images, and it's not reality, it's not connection. So it's very different. So it's that, it's the quick images and heightened dopamine and all of that. So and then, to be compared to what, transpires on porn, is really challenging. So like I said, thrilled you're here, thrilled that you're able to say, I'm a kind and nice person, and I've always loved who I am. Good. Hold on to that.
Put yourself around people who can affirm that you are one to be loved. I mean, it's not saying that you're imperfect. Crap happens in relationships. Like, we're very imperfect in relationships. It's not that you can't own that you fall short in a certain way here or there, but do not ever, ever, ever let somebody who's also extremely imperfect, by the way, and very unhealthy right now, recite all the ways that you're broken and wrong. Don't ever let them do that to you.
Someone in active addiction, I use the term broken all the time. They're broken. I mean,
but extra broken when they're in active state, right?
Like
they're drowning and they're looking for anything to drag down with them in that state.
Yeah. Comment. So what's next on your list?
So the next question would be, how can I kind of be assertive and show up in the relationship, in the marriage? So we're sitting there, we're rumbling with some difficult stuff in the therapy office. Then we're also going home and we're trying to apply those things and be assertive without maybe being too much of a nag or appearing to be too aggressive in those states, right? So, because there's a lot of things that come up, right? So my partner's supposed to be in recovery, supposed to be doing X, Y, and Z, going to these meetings. And I feel like I constantly have to be like, did you make that appointment? Are you going to your meeting tonight? And then they kind of hate themselves because they feel like they're a nag. And then their partner goes, oh, if you weren't such a nag, right? Or someone being aggressive of like, hey, I'm doing my recovery plan. And you said that you were going to work on your anger management, work on your rage. Like, I've tried everything I can to kind of be present and own the fact that I've betrayed you. So you're going to be very dysregulated and you're going to be very angry at times. But I really want to know that you're keeping your side of the street clean and, going to your support groups, going to your, equine therapy or your yoga classes to try to recenter yourself. So I'm not always with someone who's so angry all the time, right? So that's that, how do I present and share this stuff in my marriage setting or in my coupleship setting without being nagging or aggressive or whatever. So when we talk about how to be assertive, lots of words come up for me, which is like vulnerability, which is, because I'm the Brene Brown person. And so to be assertive, to show up and be seen without really knowing, no guarantee of how it's going to be received or if you're going to be liked or disliked, that's vulnerability. And it takes a boatload of courage, and you have to rumble with your shame voices. So when you're wanting to say, hey, I really need this need to be met, I'm really noticing maybe I'm a physical person, and so I need more hugs, or I need more affirmation, and I need someone to say, if I look nice that day, to tell me that I'm nice, like things like that go 100 miles. Or, it's like those 5 languages of love. Or do I really appreciate when someone does chores or acts of service with me, or we just go on that hike together? Like, I've now found out through all the work that I've done that like calms me down and recenters and grounds me, but I need to do that with you. So how do you show up and be seen and kind of present this need to somebody? Well, you have to first rumble with those shame voices, because there's those voices that are like, oh, you're being very unpleasant, you're not going with the flow, oh, people don't like people who have needs, who like, so you have to really hear what comes up for you when you want to present an expressed need, because there's been some reason in the past why you've been invested in not saying it, why you've been invested in not realizing that you had this need, right? Some kind of message that's been like, just keep playing the game, just keep following whatever their rules are, and behave in the relationship the way you think you're supposed to just keep that person in your life. So it's really, really changing the whole dynamic. There's also this other concept of, sorry, I'm grabbing something, which is living big. So there's the whole Brene Brown material that's basically, if I'm going to show up and be seen, there's 3 properties that I want to try to maintain in order to kind of show my best, put my best foot forward. And that's, she uses the acronym BIG, B-I-G, which is B is boundaries, the I is integrity, and the G is generosity. So boundaries is just simply, I've done my work to know what's okay and what's not okay. I've done webinars on boundaries, and I'd really encourage you to check that out, because lots of new boundaries are going to have to be set up when you're in a state of recovering from this major crisis, kind of from destroying the old relationship that you thought existed and rebuilding a new one. All the structure is going to be grounded on what's okay and what's not okay, what your values are, what your goals are. That's all going to create a really strong structure around the new coupleship that you're creating. Integrity is kind of saying what you mean and mean what you say. So integrity, one of the core words of it is integrated, to be integrated. And so because I've done all that really great boundaries work, I know what's okay and not okay. I know what my values are. I know what my goals are. I will act and behave congruently with that. So I will act in alignment with all of that, and also what our mutual goals are and what our mutual values are, and for an appreciation of what your comfort level is and what you're okay with, right? And then generosity is this concept that I work from an assumption and an intention that people are doing the best that they can, even though it doesn't look like it. And it's extra difficult if you are in a relationship with if you're in a relationship with an addict, is because you see that they do all this behavior that just makes no sense, and all these hurtful things come out of their mouth, and they do so much damage. And it doesn't actually even need to be an addict. It can just be an emotionally unhealthy person. An incongruent person is capable of doing so much damage. So it's really hard to come from a generous place where you understand that even in these damaging type of states that one gets in, we're still doing our best. We're still trying to manage whatever disaster we have going on in our heads and our heart. And so that's kind of just meant to kind of shift your heart a little bit and not come in from this righteous indignation or self-righteous place of like, oh, hell no. It's just supposed to be like, I know that you think that this is the right way to come about this, but I'm not okay with this. Everything about this is really uncomfortable for me. In fact, when I see you do this, I wonder why you're doing it. I question it. And it just allows you to have a much more richer engagement with your partner when you're trying to assert your needs in the coupleship. Of like, if I come from a place of generosity where I can see you as a flawed human being, and you're in a state of struggle, I don't understand why you're doing what you're doing, and a lot of what you're doing is hurting me. But if I can come from that, I can have a lot more engaging questions that might create some more clear solutions versus just like, you hurt, get away from me, you're bad. So those
Can
are
you
just
hold
some
that
suggestions.
worksheet up again? Somebody, can you hold
Sure.
it up for a second?
It's just from Brene Brown's worksheet of what she calls living big, is to just really explore what your boundaries are. Are you living in integrity with them? And are you giving people generosity when you're engaging with them in really difficult subjects? Here's a little bit more. This is another sheet that I came across. It's from another one of her workbooks. I would post these, but there's copyrights, so I'm not allowed to like post the hard copies, but I can tell you the content, which is express how you feel, ask for what you need. You know, I want to show up and be seen in this area of my life. So let's say if we focus in on the coupleship, I want to show up and be real. I want to have real intimacy with you. I want to be able to share intellectual intimacy, emotional intimacy, physical intimacy, spiritual intimacy. I want to engage with you in this way. But holy crap, it's really scary because you've been very dangerous. And quite honestly, I don't trust myself, and I don't even know what that is that I'd be presenting to you. So I got to do a lot of work in that. For me, this feels like, and I kind of explained it, scary, vulnerable, like I'm setting myself up to get screwed over by you, like I'm being the dumb one, like I'm pathetic, you know, things like that. How can you support me? So when I'm feeling that way and I'm presenting something to you, knowing that I feel embarrassed. I feel like I don't even feel like I can speak correctly because I've never really talked about my thoughts and feelings and asserting myself in this relationship, and I want this and I need this. So I need you to like not make fun of me. I need you to be patient with me. I need you to hug me or hear me or tell me that you understand. The next thing is, here's what support would look like for me in this part of my life. So when I share my wants and needs with you, and I told you how scary it is for me, these are the ways you can support me, and this is what it would look like. So you would have eye contact with me. You know, we wouldn't do this over text because now we know neurobiology. We need to see face expressions. We need to see your eyes at me. I can tell like unconsciously if you're listening or not. And then I need some kind of reciprocal statement from you that's showing that you're tracking me, that you hear me, that you don't think I'm a crazy person or I'm too demanding or I'm too naggy or I'm being too aggressive. So I need some kind of reinforcement that you can validate why I would have that need, and that you're doing your best. And this is why it's important to me. So this is why stating these needs are important to me. You know, this is why it's going to help me feel safer. I do think when you hug me or give me words of affirmation or do these services, that it's going to help me feel safer and closer to you. And I want that. I don't want to feel so unsafe all the time. I do want a marriage that's going to work. I do want us to all be a family again. And I think that these are going to be steps that's going to help us move towards that. Move towards forgiveness, move towards trust again, all that kind of stuff. So that's a nice little outline of how to kind of present those things. With the understanding your autonomic nervous system, right, is the more you can write down when you're in a calmer state and a more executive functioning, like collective state, that's when things are going to make sense to you. Things are not graceful and pretty and come out clear or nor received that way when we're back here in that fight, flight, or freeze, in that sympathetic and dorsal states. So yeah, anytime you can do work, journaling, I'm a huge proponent of journaling, doing these types of workbooks, I think is great. I have to clarify that executing boundaries does not always mean it's going to feel good, because boundaries make you really rumble with the shame voices, like I said, about being assertive in a relationship and showing up and being seen. It's that same of like, oh my God, if I'm going to be that unpleasant one, the one that says no when everyone else says yes, or I'm, and it's going to really trigger, like I've already experienced so much rejection and abandonment. So maybe I want to perform and not have boundaries in this area of my life so someone could affirm me and tell me that I'm a good parent or tell me that I'm good at this, because I'm so starved for someone to tell me that I'm enough.
So
Yes. Hi. And you also can go to KristinSnowden.com, or again, search me on Kristin Snowden on YouTube. And thank you so much for joining us today. I appreciate it.
thanks everybody. Bye-bye.
Bye.